Hi, this is Beatrice,
And this is Shirley.
and we are the co-directors for Operation Diabetes. We're sorry we could not make it today, but we made this special presentation just for you guys. So, what is diabetes? So we're just gonna go over a review of diabetes, which you guys all know so well. So we'll just jump right into it. So diabetes is characterized by a high level of glucose in the blood. Classification of diabetes can be type 1, which is insulin dependent, type 2, non-insulin dependent. There's gestational diabetes, which is insulin resistance during pregnancy, or can also be any genetic defects in beta cell function, or disease of exocrine pancreas, or drug or chemical induced. So the pathophysiology of type 1 diabetes, it can be pancreas produces no insulin, and then therefore you have to manage it with insulin injections. Whereas type 2 diabetes is where your pancreas makes insulin, but it's inadequate. The insulin receptors in the body are resistant to the insulin being made, and then your sugars aren't being taken up due to inadequate insulin production or insulin resistance. So a comparison of the types of diabetes. So type 1 is less prevalent than type 2. So type 1 is about 5 to 10 of adult cases, whereas type 2 is 90 to 95% of adult cases. And then onset for type 1 is usually early onset, generally diagnosed in children, whereas type 2 is later onset, greater than 40 years old, and is generally diagnosed in adults. For symptoms for type 1 diabetes, is usually weight loss, and then there's the three P's, so polydipsia, polyphagia, and polyuria, where type 2 diabetes is asymptomatic. Again, the pathophysiology for type 1 diabetes results from beta cell destruction, which is the absolute insulin deficiency, so you're insulin dependent, whereas type 2 diabetes results from insulin resistance and defect in insulin production. And usually for treatment for type 1 diabetes will be with insulin, and for type 2 diabetes it can be lifestyle modifications, medications, and eventually insulin. To assess these diabetes, your sugar levels, you can do an A1C test, which is the average blood glucose concentration over 3 months. You can do the fasting plasma glucose, which is your blood glucose checked after fasting, which is no caloric intake for at least 8 hours. Then there's the oral glucose tolerance test, which is when you fast for more than 8 hours and then you consume 75 grams of glucose and then measure your blood glucose after 2 hours. So for the 88 guidelines for 2017, for normal A1C will be less than 5.7%. Pre-diabetic would be from 5.7 to 6.4%, and diabetes is more than 6.5%. For fasting plasma blood glucose, for normal you want less than 100 milligrams per deciliter, and then pre-diabetic would be 100 to 125 milligrams per deciliter, and diabetes would be greater than 126 milligrams per deciliter. And then for the oral glucose tolerance test, it's going to be less than 140 milligrams per deciliter for normal, and then pre-diabetes is 140 to 199 milligrams per deciliter, and diabetes is greater than 200 milligrams per deciliter. If they have a normal value, you'll get checked every 3 years, where pre-diabetes will be checked every year. So for non-modifiable risk factors, it's age greater than 45, family history of diabetes, ethnicity, so African American, Latino, Native American, Asian American, and Pacific Islander, and any previous diagnosis of gestational diabetes or previous delivery of a baby greater than 9 pounds. For modifiable risk factors, it's people who are overweight, so BMI greater than 25 kilograms per meter squared, people who do not exercise regularly, or comorbidity, so hypertension, a value of greater than 140 over 90, dyslipidemia, so HDL less than 40, or triglycerides greater than 250, And then there's polycystic ovary syndrome, and then CVD. There's also disease-induced and also medication-induced.
So here we have some of the symptoms of hyperglycemia, usually caused by too much food or too little insulin, or also due to stress. Some common symptoms are the 3Ps: polydipsia, which is extreme thirst. There's also polyuria, the frequent need to urinate, and also polyphagia, which is constantly hungry. Some other symptoms you can ask your patients are if they have dry skin, or check their vision, if they're drowsy, and also if healing wounds tend to heal slower than usual. What they can do if they have these symptoms is to check their blood glucose, and then depending on the value, they'll call their healthcare provider or see urgent care. For hypoglycemia, this is due to the lack of food or skipping meals or injecting too much insulin or intaking too many diabetic medications. Some symptoms are shakiness, palpitations, which is an irregular heart rate, sweating, dizziness, polyphagia, issues with their vision, weakness, anxiety, irritable moods, and also a headache. And they can check their blood glucose again, and after that they will treat it using the 15-15 rule, where they would wait 15 minutes, take a couple sugar candies or drink some orange juice, and then they'll check their blood glucose again in 15 minutes and see if that level is higher than 70 milligrams per deciliter. Oh, so here we have some of the treatments of hypoglycemia. Low blood sugar levels are less than 70, and it's really important to recognize these signs because you don't want your patients to faint. And these require immediate treatment. Like I said, you're going to do the 15-15 rule, and if the sugar levels are still low, then you're going to repeat them again. Some complications of diabetes are microvascular, which are neuropathy, which can lead to amputations, and retinopathy, leading to blindness. So that's why we recommend an annual dilated eye exam, and also nephropathy, which causes issues with your kidneys. Some macrovascular issues are heart attacks and strokes. Here we have the goal levels for diabetes based on the ADA guidelines. Fasting blood glucose for diabetic patients is anywhere from 80 to 130. Random is less than 180 with an A1C of less than 7. Their blood pressure is less than 140/90. And LDL, we're using the 10-year ASCVD score. HDL, men is greater than 40 and women is greater than 50 milligrams per deciliter, and triglycerides are less than 150. Here are the goal levels for diabetic patients according to the American Association of Clinical Endocrinologists, with a fasting blood glucose of less than 110, random blood glucose of less than 140, A1C of less than 6.5, and blood pressure less than 130/80. However, the blood pressure goal should be less stringent for older patients. LDL less than 100, HDL less than 130, and triglycerides are 150. So here we have a few of the community health activities that we did. So as screening directors, we go to majority of the health fairs. Here are some of the ones that are listed. We went to Bread of Life, Trojan Family, SNAFA, CHAPSA, VAPSA, CAPSA, PharmSC, MapSC, SAM, and NCPA. We also kept our connections with the Indian Revival Church, and we go to them like at a quarterly basis. And also there's World Diabetes Day on November 14th. So these are some of the health fairs, and here are some of the ones that we participated in. This one was at CHAPSA. Here we have Beatrice at VAPSA. And then this was CAPSA, and the last one was Trojan Family Health Fair. So World Diabetes Day, As some of you may or may not know, World Diabetes Day is a global awareness campaign that focuses on diabetes and is held every year on November 14th. The goal of this campaign is to bring awareness to this chronic illness and to educate the public about the health concerns that are a result of diabetes. This year, Operation Diabetes collaborated with SNAFA's Director of Diabetes Initiative to help raise awareness about diabetes. We set up a couple of poster boards and interactive activities along with an Instagram cutout to bring more awareness of this global health issue during lunch on November 14th. Since this campaign is represented by Blue Circle logo, which signifies the unity of global diabetes community in response to a diabetes epidemic, we encourage our committee members and also other students to wear blue as well. Okay, so here we have our poster board. There are a lot of changes that we wanted to do to our poster board, and we also want to update a few of the images. We plan to do this with our committee members and also the future directors of Operation Diabetes. And some changes made this year, we decided that it is beneficial to train before the health fairs. It allows us for the screening to go very smoothly. And the main issues that we found were forms weren't being filled out correctly. So if we kind of teach them beforehand, like on a Friday, instead of the Saturday of the health fair, then they have a higher chance of asking us questions, and they can get their answers immediately. And also, we feel that the students tend to be more confident when we train before health fairs. We also plan to attend the India Revival Church. We used to attend this on a monthly basis, but our advisors actually encouraged us to continue screening, but at a quarterly basis because the health fair schedule was pretty busy. And this year, we continue to organize all the education materials that we have made over the years and for our next directors of Operation Diabetes. And here are some of our references that we use, which is the ADA and the AACE guidelines. And that's it. Thank you for listening.